बोल देता हूँ मुझे. Now you can start.
Welcome everyone. I'm Dr. Nitika from Medical Affairs Tata 1mg. Tata 1mg is India's largest healthcare platform, which can be accessed for all your health needs. You can order your medications, get lab tests from the comfort of your home, consult expert doctors, and access expert-vetted health information. On the occasion of World Health Day, here we are with an exclusive webinar on sleep wellness. We are very excited to have Dr. Pratibha Dogra with us. Dr. Pratibha is an experienced, enthusiastic, and empathetic physician specializing in respiratory and sleep medicine. Dr. Dogra brings in 15 plus years of rich experience across different types of sleep disorders. Hello, Dr. Pratibha. Most welcome.
Thank you. Thank you, Dr. Nikita, and thank you, 1mg, for giving me this opportunity on this platform.
Yes.
I think this is a very relevant topic that we are going to talk on and discuss today.
True.
I just share my screen here with all of you.
Hi, बढ़िया जी.
Yeah. So good afternoon, good evening rather, everyone. Today we are going to talk about sleep, and the topic I like to say is wake up to sleep, because there is so much, that is awareness which is required around sleep. So since time immemorial, if we talk about as humanity, we have been very fascinated by sleep. And to most of us, we used to think it is more like a passive process because we didn't understand what happens during sleep. So the way we know more about, our bodies or our rest of the organs, our knowledge about sleep was limited till quite some time. And we used to associate sleep with fairies, with monsters, with dreams. Then the question arises, is sleep medicine a very recent kind of science? But if we look into our scriptures, our ancient scriptures, I think our rishis, and they have also been able to kind of understand the stages of sleep, because if we just look at this, they say that from wake we go into transition, and then there's a dreaming, and it's going to unconscious and the deep sleep. So this is almost like the stages of sleep that we understand now after all these years of scientific research. So now how we define sleep is that it's a natural periodic suspension of consciousness during which the powers of the body are restored. And the importance of sleep lies in, because it is a physiological process. Like breathing is a physiological process, like digesting is a physiological process, so is sleep. And the importance of sleep lies in that it is important to provide rest to the body, relief of tiredness, it re-energizes us, conservation of energy happens, and lot of restoration of cognitive abilities. So what is actually happening during sleep is the body is trying to restore and recover all the biological processes. So if we talk about endocrine system, which is to do with our hormones, the hormone production during sleep, which is essential for good metabolism, is happening. In nervous system, the sleep allows nervous system to rest and restore. It allows us to consolidate our memories. The heart rate decreases, the cardiac output decreases. So all the systems, they kind of slow down so that they are restored, their functioning is restored, the biological processes are recovered. As now we understand sleep, we know that sleep is not a unitary phenomena. It's not that at one point we are awake and at the next point we are asleep. So we go from, as I just showed the previous the slide, in which even our ancient scriptures, they talk about stages of sleep. Here also now we know that it is happening in sleep stages. So from wake, the body goes into N1 stage, then it goes to N2 and N3, which is a deeper sleep. In between these red portions, which you can see, are the REM sleep, or the REM sleep, which is a dreaming sleep. So stage 1 is a transition from wake to sleep, and then stage 3 is the deeper part of the sleep. And this is something like, if we measure sleep through the night, this is the kind of hypnogram, that is how our sleep looks like throughout the night. And as you can see from this graph, this red portion, which is our dreaming sleep, as the night is progressing, the proportion of REM sleep in each cycle is increasing. So that is why usually we wake up kind of recalling our dreams. And if we don't kind of sleep for a little appropriate number of hours, like we don't sleep, like we sleep less than 6 hours, we say, oh, we are not dreaming. So we have not dreamt since many days, because the dreaming will happen only if we are sleeping like 6 to 8 hours and the REM sleep kicks in. Because as we, at the beginning of the night, the amount of REM sleep is very less. So this is the cycle of the sleep, where this, from awake, we are going to N1, N2, N3, then the REM comes. So this proportion of REM sleep increases as the night progresses. So to have that dream sleep, which is very important again, because it is helping us in restoration of our, or consolidation of our memories, that can happen only if we are sleeping adequate number of hours. Now the question arises, what is the adequate number of hours? Well, this, again, to whatever we understand till now, it is, again, it varies from age to age. Like for infants and children, infants, they can sleep like even 16 to 18 hours, right? And children, they should be around 10 hours per day. Teenagers, they need 9 to 10 hours. But I will say this is one cohort of, humans which are taking the least amount of sleep, because this is the time when they're students and they're very engaged, and there is a lot of pressure, and they're on the gadgets. So any teenager who should be like sleeping for 9 to 10 hours, I will say in our times, it is like hardly they're able to get 6 hours. So that is creating a lot of sleep deficiency in teenagers. For average adults, what they say is around 7 to 9 hours is enough. So I would say anywhere 6 to 8 hours, going by what the kind of lifestyle we are leading is should be enough for leading a good active life. Another thing that we have learned now is that sleep pattern, it changes with age. As I talked about the REM sleep, which is the dreaming sleep. But as we age, as the humans are aging, the amount of REM sleep keeps on decreasing. So in children, when the child is born, the amount of REM will be 50% of the total sleep time. But as the humans are, aging, the amount of REM, or the amount of this dreaming sleep, is also decreasing. So the structure of the sleep is changing with age. This is one of the persons, I will say, because of whom the entire relationship of human being with sleep has changed. So Thomas Edison, right? Before the light was invented, the human beings were almost following the day-night rhythm. So our bodies were, we say, entrained with this day-night rhythm of this, of the circadian rhythm, we call it as. So the humans will wake up with the daybreak, and they will go to the bed with the sunset, right? So we were almost pretty much like other living beings, and we were following the circadian rhythm. Our bodies were very much entrained with the day-night rhythm, and actually that kept all our problems at bay. But once the light was invented, this is what happened. So there was the boundaries of the day and night merged, and the human beings, being humans, the greedy human beings, they wanted to make the most of whatever they can. So it was the kind of the normal, the belief that started coming up was that sleep is for the weak, because if I can work as long or as hard as for a number of hours, I can make more of life. And as the society is westernized, almost night work became an institute. It became a normal thing. And the daytime sleeping, or the siestas, which were the afternoon naps, they were just almost became outlawed. So if you can just make a sense of it, that our transport is increasing at the rate of 34% per year, and the roads are increasing at the rate of 6% per year. It means that somebody is driving on these roads at night is also increasing. So what we are going through is almost like a sleep restriction endemic. The total sleep time is decreasing, the work time is increasing, the travel time is increasing. So just to maintain the lifestyle, what we are leading, the amount of sleep, the total sleep time a human being is taking is decreasing. And on the top of it, to stay awake, we are also telling you can choose your level of awake. So just choose the concentration or the strength of the coffee to stay more awake. Again, humans, again, though they are like, greedy, but they are also smart and they're intelligent, and they also kind of go by the evidence. And then slowly the research started kicking in again, because this research now started telling us that sleep is important, so we cannot just keep on ignoring the sleep. So there were so many studies, like, because from going from this belief system, like Benjamin Franklin somewhere wrote that waste not life, in the grave will be sleeping enough. So from going from this belief system, we really did a very strong evidence of body to tell us that it's not that sleep can be ignored, that we have to put importance to sleep. So a lot of research started happening, a lot of articles, and which now has established that sleep is important. It is helping people to learn complicated tasks. And we also now understand what are the consequences of sleep deprivation, which, just to list few, are decreased alertness, increased in irritability, lack of concentration and judgment, decline in productivity. There is higher risk of anxiety, depression, traffic accidents, obesity, cardiovascular risk, and type 2 diabetes. And of course, like if you are not, sleeping for the adequate numbers of hours, you can unintentionally fall asleep, and that can lead to a lot of issues. Lot of accidents do happen because of this. And like if you just look at the Chernobyl kind of disaster and the Pacific oil spill and other disasters which humanity has seen, maybe has been pointed out that somewhere someone didn't sleep well through the night, and that led to errors. And that is why this happened. And this is seen so much in specifically, the drivers, the public transport drivers. If they are not sleeping well, and they, because of various issues, there's a possibility of their kind of falling asleep while driving and leading to various accidents. This slide is again to bring home the point that, as a society, we have become very, very kind of vigilant, and we have become very we know what are the disadvantages of alcohol and driving, and we are making it a point that nobody's driving while they're drunk. But even nobody is paying attention to that. Even if somebody is not sleeping properly and they are driving, that also increases the risk of accidents at the same level. So there is a loss of time in bed, which is like if somebody has lost like 4 hours in bed, is almost equivalent to that some patient but has drunk 5 to 6 beers. So this is so equivalent, but nobody is like looking at if somebody is having a night shift and after working night, the person is driving. Nobody's checking on that the way we are checking on that people should not drink and drive. So even the loss of sleep will lead to almost equivalent level of decrease in vigilance. Sleep deprivation is impacting almost every system of your body. When we talk about it, impairs memory and learning. It lowers libido. It decreases general activity. Your reactions become slow. The skin starts it's like early aging, I will say. It shortens your attention span, worsens the mood, and it puts pressure on your heart, which can be the cardiac issues can be increased. So because again, as we discussed, that sleep is required to restore and kind of restore the entire biological processes. So it is impacting all the systems of our body. To the extent now there are studies which tell us that sleep deprivation can also somewhere be linked to some cancers. Now coming to what is happening, why, what are the factors which are contributing to poor sleep, and why our society in general, we are now laying so much stress on the sleep deprivation is, again, I will say the lifestyle changes that has come with the modernization of the society. There is, people to drink alcohol has almost become a norm. There's a lot of polypharmacy that, people are having, or, they are on many pills because of various diseases, or we call it as multiple comorbidities are there. A lot of travel is happening across the time zones, which is leading to jet lag, which is leading to other kind of sleep, deprivations. And then there is, there's a lot of, again, the gadgets and the lights and everything is so lighted. In generally, the night doesn't look like a night these days. Rather, we are not able to see the stars and the moon is still visible. We are not able to see the stars anymore because of generally the city lights are so kind of, they're so sharp, they're so intense. There is so much of technology kind of invading into our bedrooms that the sanctity of bedrooms is lost. And then there is, a couple of drinks like coffee and anything that is caffeine will kind of, lead to again, it will disturb the sleep. A lot of the things to do with the temperature also. The temperature is increasing. I'm just so sorry. Just a minute. So because of this increasing or the global warming also, where the temperatures are like increasing, that is also leading to kind of not so good quality of sleep. So now I will just like to kind of take you through because this talk is about what are sleep disorders. So if we go by the international classification, which kind of it divides the sleep disorders into 7 types. And on the top of the list is insomnia. Insomnia is something we say is difficulty to initiate sleep or difficulty in maintaining sleep. And then we have sleep-related breathing disorders, in which the most common one is obstructive sleep apnea, which is related to snoring, which I will take in a little more detail going further in my presentation. Then there is central disorders of hypersomnolence. This is like disorders which lead to increase, the need of sleep is much more without, sometimes there is a reason and sometimes there is not a reason. So howsoever long the person sleep, that doesn't seem enough for that person. Circadian rhythm sleep disorders are, something to do with the shift workers or the frequent travelers who are traveling across the time zones, and which will lead to sometimes it's like sleep delay happens because again that somebody is traveling from here to USA and then the entire time zone changes and then they're not able to sleep during night. So they are the circadian rhythm sleep disorders, which is seen in the shift workers, which again is very common with so many of call centers in today's time, and so many workers are working on the shift work. So that is also leading to a lot of sleep issues. Parasomnias are something like something different kind of perceptions that people are having during sleep. Then there's sleep-related movement disorders, something like many times we have heard about sleepwalking and people kind of getting very violent during sleeping, and then the rest of them are clubbed in other sleep disorders. So because of the time, I think I'll discuss the first 2, which are the most common and which are most commonly seen and which we come across as physicians also. So what is obstructive sleep apnea? To define it, I will tell you this is, it's a repeated episodes, like there is either a complete kind of blockage or a partial blockage of the upper airway. So this is the nose, and this is from where the airway starts. And when we are sleeping, this is the tongue, and this is from where the air passes. So people who have snoring issues, who are more, likely to have obstructive sleep apnea, while they are sleeping because of various reasons, this passage at the back of the tongue, it just gets blocked. So the air which has to pass from here to the windpipe, so it's not happening. So there is obstruction that is coming somewhere at the level of your upper airway. And because of this, when the patient is sleeping and the air is not going in, the amount of oxygen entering our body decreases, which leads to kind of, our receptors are very sensitive to it. So they kind of send a signal to the brain, and brain wakes up. And as the brain wakes up, the muscle tone comes back and the airway again opens up and the air starts going in. And then the oxygen somewhere comes back to normal. But the moment oxygen comes back to normal, the mind again relaxes, and this cycle keeps on going on, which leads to fragmentation of sleep. So your sleep, the people who snore, they have fragmented sleep. So snoring does not signify that you are having a very good quality sleep, or you are a blessed sleeper that whenever you go, you snore and it's a very nice thing. No. So snoring somewhere, anybody who's snoring, it means that there is some obstruction to the air happening. That amount of air getting into the airway is not proper. So there's some obstruction happening during the night when the patient's sleeping, which leads to decrease in oxygen and which leads to so many other effects. which we call as obstructive sleep apnea syndrome. So if the patient is snoring and is having these daytime symptoms, like they have excessive daytime sleepiness, or they feel tired, or they feel there is lack of energy and fatigue, or they have early morning headaches, they have diabetes, or they have concentration and memory problems, high BP, depression, anxiety, irritability, learning difficulties. So any person who thinks that they have these kind of daytime symptoms and they are also snoring, they are the people who should be kind of, connecting to the, sleep physician for further testing. These patients also have these nighttime symptoms. One thing is snoring, of course, as we discussed, and then they have increased frequency of urination that, their need to go to the washroom will increase. They have irregular breathing during sleep and night sweat. Sometimes they wake up with, sweaty. And the partners, they come and tell us that, many times they have observed that their partner just kind of stops breathing, or sometimes they just get up very alarmingly because they feel that they feel very choked. There is increased cough and salivation during night. This can also lead to sexual dysfunction and palpitations. So these are certain kind of, again, symptoms which we see in the patients who are snoring and who are at the risk of obstructive sleep apnea. They are very, this stop bank questionnaire, this is like very simple questionnaires which are available online. And if you kind of take these questionnaires, and it's like if you say yes for more than 3 of these, it means the risk of OSA is there. Again, you should go for testing. So there are various risk factors for OSA, and obesity is one of the most common factor which will lead to anything that leads to parapharyngeal fat or even the truncal obesity. These are the, the reasons which can lead the patient to have, cause of snoring and obstructive sleep apnea. I will show you some pictures which again, tell us the patients who can be who will be at risk of snoring and OSA. It's something like anything that decreases the space inside your mouth. So uvula, if you just see something that hangs from the back of our mouth, if your uvula is enlarged, or there are tonsils, or your lateral wall of your, the mouth is like narrower, or the chin is receded, or your mandibular is low. So these are the craniofacial structures, like the bony structure of your face, because of any reason. Because if your chin is receded and the mandible is also narrow, the space inside the mouth will be compromised. And if the space inside the mouth is compromised, our airway is more likely to kind of get closed or collapsed while we are sleeping. Some people have DNS and they're also at risk of having snoring or obstructive sleep apnea. So who needs to be tested? Again, I told you the symptoms which a person can have during day as well as night. But again, to summarize, any person who have excessive daytime sleepiness, or they feel very tired or chronically fatigued, or snoring is there, and the partner sees there is a witnessed apnea, which is breathing actually stops, and any person who is also having like snoring with comorbid conditions like diabetes or hypertension, they should definitely kind of connect to the physician and get tested for OSA. So this is the kind of an image which comes to our mind when we talk about obstructive sleep apnea, because we say it is the most common reason is obesity, but this is one archetype of it. People like, this person who looks apparently very fit and no obesity, but just because of the craniofacial structure, as I told you, anything that compromises the space inside your mouth cavity can also have sleep apnea. So we have very elaborate and we also have very kind of quick test now, means to kind of diagnose sleep apnea. This is the sleep study we do, and we are able to we look at various things like the sleep stages and the flow of the air and the movements of the kind of chest and your saturations and your heart rate. So a lot of many things are looked while we do the sleep study, and then we are able to judge what is the degree of sleep apnea. Why we are talking so much of obstructive sleep apnea? Because it is actually a kind of an epidemic. If I talk about India only, we are suspecting about more than 50 million people will be at risk of obstructive sleep apnea, and there is a lot of consequences of OSA. If it is not treated, because of the fragmented sleep, our sympathetic system kind of keeps on getting activated during night, because every time our oxygen kind of falls, the mind thinks it to be a fight. It's a very dangerous situation, and the body goes into the fight and flight mode, and the sympathetic system gets activated. And because of that, all these consequences happen, because the body is not able to kind of rest properly. All the systems which otherwise would have gone very slow, like your blood pressure decreases and your heart rate decreases, your sugar level decreases, because of the frequent falling of oxygen while you are sleeping, will not let the body to rest, and the consequences will be like insulin resistance, weight gain, frequent urination, hypertension, heart attacks, heart failure, many things. If you can think of like even stroke. So many problems have been linked to OSA, that is obstructive sleep apnea, which is a very treatable and a preventable kind of a thing. So I say that in modern medicine, snoring or obstructive sleep apnea, if we kind of diagnose it at the right time and treat it at the right time, this is the only preventive kind of therapy we are offering to you, because just by correcting your sleep disordered breathing, we will be able to prevent so many diseases which you can otherwise develop or which you already have. Okay, so that was more or less about obstructive sleep apnea, which for the common use, we will say it is almost equivalent to snoring. But I will say that snoring, anybody is snoring and have those daytime and nighttime symptoms, they should get themselves tested. It's because after testing only, we can say that the patient has an OSA or not. Next we come to is insomnia, which is again difficulty. Many people, again, almost at any point of time, they say 25% of population will be affected by insomnia, which again can be acute and chronic. It can be sleep onset, is like when patients, they feel difficulty while sleeping and falling asleep, and then there is a maintenance insomnia, in which person, there is during the night there are frequent awakenings and you're not able to maintain the sleep. So this sleep maintenance insomnia has also been linked with sleep apnea, because again, as I discussed, that leads to fragmented sleep, and that is how the sleep will not be kind of a good quality sleep. Now because I know there are so many questions that has been shared with me, so there's so much kind of curiosity on that. I would really like to kind of put a little bit stress on what are the reasons of insomnia, or we call it as pathophysiology. So what are the factors which lead to kind of this thing? To understand that, we have to see that every person will have, there is some predisposing risk factors. So we know there are various kinds of people, or there are various personality types, and we know there's a like type A personality, which is usually a kind of a person who is more worrying kinds, or is takes more stress in life. So depending upon what kind of personality you are, like you are a worrier or you are a relaxed person, so there is a predisposing risk factor in every kind of a person. So a person who is generally, there's like hardwiring personality is a very hardwired thing. It's very difficult for us to change our personalities. So usually people, who are very, maybe competitive, or, who worry a lot, who are anxious, generally by personality, they are more predisposed to have kind of sleep issues, because we say that sleep per se is kind of a byproduct of a mind at peace. So anybody who is really kind of, is having a little more difficulty there in keeping a restful mind may have problems with the sleep also. So a person is having some predisposing risk factor, but on the top of it, there happens some kind of a stressor, which can be environmental stress or medical illness, or there's a loss of loved one, or a job transition. Anything that can increases certainly the amount of stress in our lives can kind of again topple our sleep, because the people with this personality, also we call it as a fragile sleep. So they have a fragile sleep, and whenever the stress comes in, the kind of what really gets affected is the sleep. Now, when this person gets the stressor in life, then they kind of, because, this we call as they develop compensatory behaviors. So on their own, then they try to understand how they can correct the sleep. So what they try to do this by spending more time in bed, or they try harder to sleep, or they go to bed earlier, or they sleep in on the weekends, they try to take naps. So they do all kind of whatever is, available in and around, because they think they will be able to manage this thing on their own. So why go and, check with a doctor at that time? Okay, so there are so many advices they will get from here and there, and that is they try to do. So they kind of build a compensatory behavior around sleep. So sometimes it helps, sometimes it does not. So, but what should be done at this point is the point where they actually should go and see the doctor, because here is the point where actually your, some kind of pharmacological treatment can help, some kind of sleeping, pills can help. That we can suppress, because we don't want you to change your behavior around sleep at this stage, because what happens in the later time, that stressor is gone. So at that one point, whatever was the cause of the stress, so say loss of a loved one, so that is gone. Now that's a 1 year back or 2 years back. Now that part is hardly there, but then the compensatory behaviors around the sleep stays. And then that changes our entire kind of relationship with sleep. So here, what works here is, when it becomes chronic, is the cognitive behavior therapy. Here, the role of pharmacology is very limited. When I say pharmacology, it's the pills that we take. So when we try to manage insomnia, is what we are aiming at is that it should improve your sleep quantity and quality. It should improve your daytime functioning. And it should be if we are taking drugs, the minimal side effects of the drugs should be there. And the non-pharmacological treatment of sleep issues, which again I will refer, this is insomnia, is the cognitive behavior therapy. It's very important. I think this is somewhere that people are not getting here, is the cognitive behavior therapy, because the role of the sleeping pills is more or less in the very acute insomnia. When it becomes chronic, when it's prolonged. So this is where the psychologist role comes in, and the psychologists, they work with the patients and they try to change again the behavior that has, the compensatory behavior they have developed. Then cognition is like your attitude and belief around sleep. So then again, that is something, that is being brought into attention, and that is changed. And then they teach them things like, the sleep hygiene. So behavior is kind of worked on, cognition which is the belief and attitude around sleep, and the sleep hygiene is taught. It's a very well-established kind of treatment for insomnia, which is offered or which is done by psychologists, and people who are having long-term issues, they should be kind of, approaching the psychologist for getting the cognitive behavior therapy done. Again, this is somewhere, again, the people who are having sleep disturbance for a long time, or there is a medication tolerance issues are there are adverse side effects. There is clear evidence of poor sleep practices, clear evidence of circadian abnormalities, that is the circadian rhythm issues. And again, it's a patient preference also. They want to go for the pharmacotherapy, which again, I will say has a limited role in the chronic issues of sleep. Narcolepsy, again, is like one of another sleep disorder, which I just wanted to mention. This comes as like a sleep attack. These are the people who are not able to control their sleep. And during any time of the day, sometimes when they have intense emotions, they can just fall asleep. And this is associated with cataplexy, which is a loss of muscle power. There is immediate REM onset in this, that people also have a dreamy sleep, and they have sleep paralysis, and they also have hallucinations. This is mostly seen in like 18 to 20 years old, usually people. And again, should be diagnosed, because it is very limiting. Sometimes it's really kind of lifestyle limitation comes in. So again, very important to be diagnosed and treated. I'll skip the REM sleep behavior disorders, and because I just wanted to put a little bit more stress on how we understand, because insomnia. Again, when we just look at this graph, we say that any human being, they have a wake drive and they have a sleep drive. So when we are having problems with the sleeping somewhere, it means either our wake drive is more. So that when we talked about the inherent personality that you are having. So if we are anxious by nature, we are worrier by nature, our wake drive is more, and to bring our wake drive down becomes an issue. And the problems of hypersomnolence are to do when person is like has a more of sleep drives, like people who have hypothyroidism. So because of the hormonal issues, they will need more sleep. So their sleep drive is more. So this something needs to be balanced, the wake drive and the sleep drive. So when the wake drive is more, and we are able to know that somewhere the hypnotics, the sedatives that we give you helps, because it just brings your wake drive down to a level where, the sleep drive can kind of, reach there. So if you have a kind of, it's a personality which again has a lot of anxiety issues. So there the hypnotics will bring down the wake drive and bring you to the portion of the, the sleep part of the graph will come in. And sometimes when there is like a lot of, hyperarousal is when you're not able to, again, maintain kind of sleep. Again, if we just give you some sedatives, that can also help. Another thing when we talk of is cognitive behavior therapy. And then what we have found to be really helpful is again the mindfulness, or being very conscious and aware of what is, what we are going through. So it is known as mindfulness-based therapy, or again, mindfulness-based cognitive behavior therapy. And if I just look at the components of the mindfulness, again, what is mindfulness is that quality of the state of being conscious or aware of something. Again, coming from the country that we come, we are like, we have so much of, techniques for this thing. For us, meditation or yoga, it's not something that we don't understand. So the only thing is, as now from the scientific person, what we are telling you, scientific perspective also supports this. So the quality of the state of being conscious or aware of something, if we are mindful about what is happening and also what is happening during the sleep, that mindfulness also can help us to overcome the issues that we are having with our sleep. And what are the basic principles of, when we apply mindfulness to sleep is that you have to tell yourself, it's like a beginner's mind. Like, every night you don't have to repeat the same story. So it is like you have to tell maybe that every day is a new day, or every night is a new day. It's not that whatever was last night was bad, so this night will be bad. So we have to break that cycle. So you have to tell yourself that it's like every night or every day is a new day. Non-striving is very important, that most of the people, when they kind of are not getting good quality sleep, they kind of start chasing sleep. So we say when you chase sleep, it runaways more. So you have to go very kind of calm about it, acceptance about it. Okay, that sleep was not good. Because sleep is something, again, it is something that it just dawns on you. It dawns on you when you just kind of relax and when you kind of just let go. So next actually principle is the letting go, that you don't think much about it. You don't analyze much about it. So non-judging, acceptance, trust, patience. If you see that this is, again, if we keep on practicing these mindfulness principles in our day-to-day life, it's not only while sleeping, but also while we are awake. If we are practicing all these things, again, it's a very, something, again, it comes, it's a very common kind of things that we read about, which is kind of told to us. But again, it's important. We cannot undermine the importance of this mindfulness when it comes to sleep, and we apply these principles, and that can really help in kind of, it changes something inside. It changes the perception. It changes our relationship with sleep. So every night, of course, letting go is like whatever happens. So it's not that you are trying to chase so much, or trying is not that something that works while sleeping. Sometimes the contra suggestions work. It means like, rather than telling yourself, oh, I really need to sleep, I'm not able to sleep, you have to say, okay, it's fine. Even if I don't sleep, it's fine. So counter suggestions sometimes help. And totally accepting and trusting that, your body has the ability to sleep, or your mind has the ability to sleep, and completely putting that trust in your mind and body, that really helps. And a little bit on, I think this is just last 2 slides, is like what is sleep hygiene people talk about. Again, this is a set of behavior that we follow around our sleeping time. And when just to kind of, just put it in, some bullet points are that what we need to do is we need to wake up at a consistent time. So this will help us set the circadian clock so much consistent that you don't need an alarm to wake up, that your body clock will be so much entrained with the circadian clock that it will wake up when the need for the sleep is enough. So avoid napping during the day, because if we are, napping during the day, then people, especially with the people who have difficulty sleeping during night, do not go to bed when you're very, very sleepy. Don't use your bed for other things like recreation or just doing other things. Just keep it for sleeping and go to the bed, because that, your body will associate bed with sleep. Avoid alcohol, nicotine, chocolate before bed, because these are the substances which will activate your brain, and then that will cause difficulty in sleeping. Specifically, any beverages 4 to 6 hours before bedtime should be avoided. Avoid heavy, spicy, acidic, sugary foods before bed, because that will again kind of any acidic, anything to do with your GIT, the lighter your gastrointestinal system is before going to sleep, the better sleep you will have. Regular exercises is very good, but again, it should not be very near bedtime, because that will also lead to, again, activation of your system, and it will be difficult to bring it back to the sleeping level. Winding down time is important. Like before you should set a routine, like, before you go to sleep, that there, something like that's very calming, like meditating or stretching or light reading. So this is like unwind and, bring down the day to the closure, unwind, stop thinking, and just kind of, relax. The bedding should be comfortable. As I told, temperature has an effect on the quality of sleep. So bedroom should be ideally cool and dark and quiet, and just reserve it for sleep and not for the workroom. Gadgets should be generally out. And this is, I think, the signs of a good night's sleep. Thank you so much.
Thanks, Dr. Pratibha. That is really enlightening. And thank you for guiding us through the various aspects of sleep. So we can take up some audience questions.
Yeah.
So there have been many questions. So I've just divided them into like broad categories. Now, the first of all is the basic problem people are facing is falling asleep. So some people have asked questions like they take care of all the basic sleep hygiene points, and still they're struggling to sleep. When they try to sleep, they keep on thinking about what went in their entire day. It is difficult for them to relax. And then falling to sleep is itself a task for them. So any pointers which can be helpful for them?
If everybody has listened to the presentation, I think the last bit of it, when I say the mindfulness is very important. So again, so mindfulness, if you kind of think, is that you have to practice those principles, and the principles are simple: of letting go, of acceptance, of trust, of beginner's mind. So if you just kind of inculcate these principles even during your day-to-day life as a person that you are, then definitely, again, your night is a reflection of the day you have. So if you are having good and a calming day, probably the night will be good. But over and above that, again, rather than really trying to kind of try to tackle this on your own, I will really advise you to go to the psychologist and get this cognitive behavior therapy done, because any person who is struggling with getting a good sleep for a longer time, the CBT treatment is one thing that really helps. So that is a very established mode of treatment. And once you because there's somewhere you need to change your relationship with sleep. So the trust is gone. So again, you have to rebuild that trust in your sleep. So that, of course, you can do on your own, but if not, it's not happening, then I think a help of a psychologist definitely helps. Definitely.
True. Then the other question is about dreams. So many people struggle with dreams, and sometimes they're scary enough to wake them up in the middle of the night. So is it normal? Is it abnormal? And how do you associate dreams? Like you emphasized how dreaming is a part of REM sleep and it is a normal thing to have. But if it wakes you up in the middle of the night, is anything to be done about it?
Um, so dreams is a very normal thing. It's a very much normal. It's good that we dream, because what we understand now is that dreaming part of the sleep is the part where we are consolidating memories. So actually, while we are dreaming, the human mind is trying to make the sense of all what we have felt and what our experiences have been.
Right.
So somewhere it is trying, your unconscious mind is coming and telling you, okay, this is what's going on. So not that you should be really giving a lot of importance to it, but somewhere, yes, you can kind of, it's kind of, you can think on it, that what is really happening in your life, and you can just pay more attention to the way you're feeling, or, what I'm experiencing, or something that you have not paid attention. So there is a science to it, right? But again, but nothing that it is abnormal, nothing that it should be really bothering. But if it is again bothering, then again, the answer is that somewhere if it's something is a recurring dream, it's again some part of your experience is trying to come to your conscious and trying to, get kind of, attention. And again, if it is bothering, again, a psychologist can help you in that.
Right. The next question is regarding menopausal women. So what should menopausal women do for sleeplessness? Any tips for them?
Generally, at the menopause, what definitely helps is that generally your lifestyle has to come to a very healthy lifestyle. So you have to maintain that, that any amount of exercise will really help. So usually there is a lot of, the water retention happening, and, the hormonal changes are happening. So not specifically that, we have to work towards, changing the sleep thing, but you have to work a lot towards changing your lifestyle and bring a lot of kind of, a real healthy lifestyle in your life is like, exercising regularly, and, put a tab on what you're eating. And weight should also be, try to kind of keep your weight on the average side, rather, like it shouldn't be more. So if you're adopting these healthy lifestyles, the sleep itself will be taken care of. You just have to give yourself appropriate time to sleep. And then whatever we discussed in the sleep hygiene thing, that is again has to be maintained, that there has to be fixed number of hours sleep, consistent time of waking and sleeping. And, again, no gadgets, nothing. So yeah, the sleep hygiene has to be followed.
Right. The next question is regarding food. So, is there any relationship with the kind of food? Like you obviously mentioned that we have to keep it light before we sleep. The dinner has to be light. But is there also a relationship with the kind of food with the quality of sleep?
So yeah, I think the thing again I mentioned is any caffeinated drinks, anything that has caffeine in it, like, coffees and colas and alcohol. Alcohol is not caffeinated, but alcohol generally is it's a very sleep disruptor. So if you think that you have alcohol and you will sleep soundly, that's not right. Again, it will be really sleep disturbing. So again, the teas and the coffees, they have to be complete no, even like 4 to 6 hours you go to bed. Other than that, fatty food, anything that cause you acidity should be avoided. The dinner should be light. It should be like at least 2 hours prior to your bedtime. And any people think like, milk definitely has some, substance which is like, it's like hypnotic, or it just induces sleep. So milk is good at bedtime, but only for those people who are able to digest it, because there are many people who get indigestion with milk, and then again, that does not work well for them. Right. Even a banana has like substances. Again, these are natural remedies if people are not able to sleep well. So banana and milk, they have some substances which kind of help in induction of sleep. So that can be taken.
Right. The next question is from people who work in shifts. So you had touched on this point as well. But like people are like, how do they change? How do they need to consult a doctor and bring about changes, or something which they can do on their daily basis that can help improve the sleep pattern?
For the shift workers, I think one major thing they should be very aware of is that even if you're working in shifts, the shifts should be at least the same shift should be continuing for 15 days at least, right? It should not be like one day you are in the morning and then you're in the evening and you're in night. Like in the hospitals also, for our nursing staff and all, we kind of ensure like a nurse who is doing the night duty is doing the night duty for, for at least 15 days. because
Okay.
your body takes a bit to adapt, and once it is adapted, it will stay there for a while. But if you are doing it very, frequent changing of the shift, that will be harmful. But if you can somehow work in a way that your shifts are like, the same shift you are working for like a prolonged time, that will help.
Okay.
Second thing that we tell and talk people about is like, this is known as the anchoring sleep. Like, no matter what kind of shift hours you have, if somehow you're able to, have some hours of sleep at the fixed time, so you can, even like for the, person who's doing the night sleep, night time, who's at the night shift. So there can be some amount of, they can split the sleeping hours to some in the morning, some in the late evening, so that the evening hours somewhere they stay static. So even 2 hours of anchoring sleep will help the body kind of, stay a little kind of sorted. So anchoring sleep is to have that 1 or maybe 2 hours window of sleep, which is always there, irrespective of what shift you are.
Very interesting. Another question is regarding periods and sleep. Are they both related in any way?
Not by itself, but generally, if you have a crampy periods and something, because the discomfort will cause the sleep to be disturbed, not per se that it is having direct effect on the sleep, but just because the discomfort a female is having, that can kind of affect the sleep.
Right. So, this is the last question I would take. So, the person has written that I mostly sleep at 2 a.m. and wake up at 9 a.m. And I really want to change it from 11 to 6. So, except for like sleep hygiene measures, anything else that could, make me sleep at the right time and wake up at the right time?
We call it, sometimes it's a delayed phase sleep, and we also understand, like by humans, as I say, mostly that majority will like to they go to bed early and wake up early. But then they say some people are like owls. Owls generally wake up at night. For them, their body rhythm is such that they are late sleepers, and we call them delayed phase. So if you really want to work on your shifting your phase a little early, so it has to be done very gradually, but something like if you're going to bed at 2, so start doing it like, you shift it like half an hour before. Or another thing is like, every day, like, if you go to 2, come to like bed at 1, then come at 12, then come at, so slowly half an hour increase will happen. Even if this is not helping, then melatonin is there. Again, this is a hormonal thing that helps in changing our, the delayed phase. So if you take, and this is over-the-counter kind of hormonal therapy, and you can just take melatonin, and then you can just take at around 8 or 9 p.m. and then you'll be able to sleep by 11. So that can be done. That helps in changing the phase of sleeping.
Yeah, right. Thank you, Dr. Pratibha. That was really enlightening. And to sum up, like sleep is so essential, like you mentioned, for every process in the body, our overall mental health, our physical health. But in this like modern 24-hour society, I think
we really need to balance.
Exactly. Insufficient, untimely, poor quality sleep, I think it's a major grave concern these days. And I'm sure your session would have helped a lot of our audience. So thank you for being with us.
My pleasure. Thank you so much. Thank you, Dr. Nikita. Thank you, 1MG. Okay, ji.
Thank you.